Certified plastic surgeon here in Walnut Creek, California, and today I'm talking about one of my favorite procedures, which is the Mommy Makeover. Now, the challenging thing about a Mommy Makeover is it means different things to different people. I kind of look at this as somebody who has gone through the wonderful gift and really hard challenge of giving birth to a child. It changes our body because of hormones, time under tension, typically not getting a lot of sleep. There's a lot of changes that go along with all this, and I get to be fortunate enough to be somebody who gets to kind of put things back together. And that typically involves things kind of in the torso of the body, whether we're talking about the breasts, whether they have fallen a little bit from where we want them to be, whether they've lost volume, whether the nipple areolar complex has changed, to the abdomen where we can gain a little bit of laxity in the abdomen because the abdominal muscles aren't right where they're supposed to be or where we want them to be. We tend to add a little bit of volume or dimension in the flanks or in the sides, and the buttocks can get a little bit flatter or a little bit saggy just through all these changes. And these are all different things that can be addressed through various kind of techniques and adjustments that can be made to the Mommy Makeover procedure. Now, typically if somebody comes in and they say, look, I have 2 kids, my youngest kid is 2 years old, we're not having any more kids, I kind of want to start to get these things fixed. Awesome. Yeah, it's a great candidate because number one, we're not having any more kids. I think it would be a disservice to the patient to do this procedure if somebody's planning or even thinking about having more kids, because since unfortunately kids are the ones who kind of caused all this, there's a very good chance that if you have another child, you're going to be back in here again, and we don't want to do that. Number two, we don't want to do this immediately after childbirth. We want to let things kind of settle, let the dust settle, let your tissue recover what it can, so then we can see what we need to do. If you do this too soon after you give birth, then there's still a lot of flexibility and motion in the tissue, and we're kind of trying to hit a moving target. So I'd much rather wait typically around a year after childbirth and at least 6 months after we finish breastfeeding to let things settle so we know exactly where we're sitting, and then we can figure out what direction we want to go. And that includes how much laxity is in the skin, how much of the abdominal musculature is going to tighten back up, how much volume we've lost or gained in the breast, how much volume we want to remove or add to the breast. And all that is really in flux in that early portion. So we really want to make sure that all of that is kind of settled and stationary before we start to move forward. One of the big things with this, because it's typically done, not always, but often in patients who have younger children, is what's the recovery like? How long is it until I can pick up my child? Am I going to be able to drive? Am I going to be able to drive my kids to school? Can I take care of this? Can I take care of that? And that's a big thing because yes, the surgery is a really important portion, but recovery after surgery is, if we're not following the instructions and not doing what we're supposed to do, it can have a negative effect on the actual procedure itself. So we want to make sure that we're following all the rules and doing what we're supposed to do. So typically driving, we'll start with that. Driving is usually dictated by pain medicine. If you're on pain medicine, you shouldn't be driving. That's kind of a flat, hard rule. As far as the other variations of that, if you feel comfortable turning in the car and looking and checking and making, looking behind you, checking your mirrors, doing all the things we need to do to be safe driving, if you feel comfortable and safe doing that, it's okay to drive. So if you stop taking pain medicine 5 or 6 or 7 days after surgery and you feel comfortable doing that, then you can go ahead and drive. That's okay. You're not going to disrupt the tissue or make any dramatic changes or ruin anything if you're sitting in the car. Next is, how long is it until I can pick up my child? And a lot of that is dictated by what procedure we do. Typically, if we're looking at a tummy tuck where we're tightening up the abdominal muscles, that's a little bit longer. That's usually around 10 to 14 days, because picking up a kid, whether they're 2 years or 5 years old, it's a little bit of a weight to lift, and we use our core. We should be using our core a lot for that. So by putting your abdominal muscles back in place, we're restoring your core strength, but we don't want to stress that too much too early. The other thing is, if we're doing implants to add some volume to the breast, those most of the time the implants go underneath the muscle. If the implants are going underneath the muscle and you're picking up a child, that muscle is going to contract. And number one, it'll hurt. And number two, it can cause a little bit of downward and lateral displacement of that implant if we're doing it over and over. We don't want that to happen. So these are all reasons why, A, it's important to kind of follow the instructions post-operatively and make sure we're staying on the right course, and B, to make sure that we're listening to our body. And I've talked about this in other videos, but If you do something and it feels comfortable and it doesn't hurt and there's no issues, that's your body telling you, for the most part, it's okay to do. If you do something and it feels really uncomfortable or really strained or it just doesn't feel right, that's your body telling you, I'm not quite ready to do this yet, and that's okay. As long as we listen to our bodies, we're going to be able to move through the healing process steadily and progress through the steps, and we're going to kind of get to where we want to go in the timeline that we're supposed to get there in. Now, the biggest thing when a patient comes in and talks about a mommy makeover is sitting down and talking with the patient, figuring out what her goals are, because everybody has different goals. Some patients want to get back to where they were before having kids. They say, look, I used to have a pretty flat tummy. I want that nice and flat again. I just want to be what I was before I had these kids. That's great, that's totally fine. Other patients say, look, I never had a lot of breast tissue. I'd like to add some more volume. Okay, then we can talk about doing an implant. I have other patients that say, look, my breasts have always been too big. I want them to be smaller and perkier and match the rest of my body. We can do a reduction and a lift. There's a lot of different permutations of this, and a really important thing is to sit down and talk with patients and figure out what their aesthetics goals are. This is something I try to spend a lot of time doing. I typically give myself at least 45 minutes to sit down and talk with people to make sure that we can get all of these things hashed out, because if a patient comes in with an idea of what they want for their surgery and the physician kind of ignores it and just uses what his or her view is, the patients aren't going to be happy because the aesthetic goals are not going to match. So that is kind of paramount to all of this. Once we've established kind of what the aesthetic goals are, then we can look at and say, all right, what path are we going to take to get through this? Whether that's a breast augmentation or a breast augmentation with implants, or a lift or fat transfer or reduction or a tummy tuck or fat transfer to the butt or just liposuction. There's a wide variety of things that you can do. And that's what we spend the time talking about. Now, a couple things I always throw out there is, number one, when people go home, if I don't bring this up in the consult, people always go home and they look this up and then they email me and say, you didn't talk about drains. The reason I didn't talk about drains is because I don't use them. Doing 99% of breast surgery, we don't need to use drains. There's a lot of surgical techniques that we can utilize, and post-operative care that we can utilize that alleviates the need for drains, so we don't have those tubes hanging out that are draining fluid that everybody thinks is gross and that are also pretty uncomfortable. So we don't need to use those for the breast. For the abdomen, we don't need to use them for the abdomen because I like to do what's called progressive tension sutures. What progressive tension sutures are is we're basically quilting the different layers of tissue together to prevent that little pocket that can form where fluid can accumulate. Now, the traditional way of doing that, or the older way of doing it, is to let the fluid accumulate, have drains in there that drains the fluid out. So you're kind of treating the symptom. I like to step back and say, well, why don't we just treat the problem and prevent that from happening? So we're just sewing those layers together so you don't get that fluid accumulation. So then, again, you don't have the drains, which are uncomfortable and not super fun to deal with. The other good thing about progressive tension sutures is it takes the tension off of the incision. You've heard me talk about this in previous videos, where tension is the enemy of a nicely healing scar, because the more tension there is, the thicker the scar is going to be and the wider the scar is going to be. So by putting the tension kind of along the entire abdominal wall, we alleviate the need for adding a ton of tension down on the incision, so things feel and look much more comfortable. And in that same vein, I often use a long-acting local anesthetic called Exparel. Now, Exparel is kind of made up of the same material as Novocaine and lidocaine and all the other local anesthetics that you may have heard of through the dentist, except Exparel lasts for up to 5 days. So in areas that can be painful for a longer period of time, like the chest muscle for a breast augmentation or the abdominal muscles for a tummy tuck, I'll inject that local anesthetic there, which gets us over that hump, because that way, yes, it's still uncomfortable. Yes, you're still going to feel a little bit sore, but it by no means is it nearly as sore as we used to get from it, because you have that local anesthetic in there kind of tamping down that pain response. With that, it tends to kind of keep your nerves a little bit calmer. And what I found is if we can keep your nerves at a relatively low reactivity level, meaning we don't let the pain get too out of control in surgery, because I use a ton of numbing medicine in surgery, but also after surgery, we want to stay on top of the pain. We don't want to be chasing it. So if your pain's getting to a 3 or a 4 or a 5 out of 10, take your pain medicine, keep it down low, Don't let it get to a 6 or a 7 or an 8 or a 9, because then you're chasing it. And once you start chasing it, then your nerves get all hyperactive, and then all of a sudden they are staying hyper-reactive, and you're in more pain for longer. So post-operatively, the most important things that you can do are, number 1, kind of listen to your body. Number 2, stay on top of the pain. And number 3, wear your compression. Compression garments, whether they're for the tummy, whether they're for the breasts, whether they're for everything, are really helpful towards limiting the amount of swelling that shows up. And for the more we can limit the swelling that shows up, the faster you recover. Because for every little bit of swelling that shows up, your body has to do work to get rid of it. So if we can prevent your body having to work to get rid of it, you're going to heal faster. Now, I know I kind of gently touched on a lot of different procedures, whether it's a breast augmentation with implants, with fat, breast lift, tummy tuck, fat transfer, liposuction. There's a wide variety, and I'll go farther in depth with these either in previous videos or in future videos, but this is just to kind of get a general overview of what a mommy makeover can entail. Now, if you have any questions about this or any previous videos, or if there's anything you want to hear in a future video, please reach out to us, and we'll be hearing from you guys soon.